Welcome to the Lawrence Davenport Show. Our guest this evening is Dr. Herb Stubb. Herb is the former Commissioner of Aging for America's Mayor Giuliani. He served in that administration. He was the Chief Operating Officer of Little Flowers, and now he's a teacher at Baruch College in New York. Herb, welcome to the show.
Great to be with you, Lawrence.
You know, as a Commissioner of Aging in one of the largest cities in America, you've had an opportunity, a unique opportunity, to look at some of the potential problems and actual problems for the aging population in America. And a lot of our cities do not have what New York has in terms of transportation, the bus and the subway that in order to get around. What were some of the issues that you faced as Commissioner of Aging in New York?
Well, actually, just to your earlier point, I went to Mayor Giuliani and made a case that we should be promoting New York City as a place to retire because so many people just go on automatic pilot and move to Florida or some other Sunbelt location only to find years later that that community does not have the services that they need and they move back or they move halfway back. So my point was, why have all that disruption in your life, especially as you get really older and frailer? But to your actual question about some of the problems that are faced by older people, mobility, as you point out, is one, but certainly health, wellness is an ongoing issue. It's something that Mayor Bloomberg has continued what we did in trying to bring in senior centers of the future that focus on wellness, have a lot more exercise, have a more nutritious diet for the seniors who eat lunch or some other meal at the senior center. And then I would say the homebound elderly is a special problem that New York City has done well with both public and private funds. New York City founded the concept of having private dollars supplement what the government does to serve meals to something like 17,000 homebound elderly every day. So that is millions of meals each year. You know, the government just pays for weekday meals, and then private dollars pay for the holidays, Saturdays, Sundays. So that really New York, in this particular case, does a better job, I think, than any other city in the country.
Mm-hmm. How do we provide health services in such a large and growing population? What should be the private-public partnership on that?
Well, you know, with Medicare being so dominant for people 65 and older, you know, there's less of a private component to caring for the elderly, except that, of course, the providers themselves who take government money and private insurance money are the ones who give you the health care. I would say home care, especially in urban settings, is very valuable. New York City certainly does more home care by far than any other country, funded by Medicaid, some funded privately and some funded by programs that only New York City funds for people that say are just above the Medicaid rate, but still are relatively low income. So if you can get home delivered meals, if you can get home care to someone, you can keep them at home where they prefer to be a lot longer. And it's also, in general, a lot cheaper than a nursing home. In some certain specialized cases, home care is more expensive than a nursing home, but for 90+% of seniors who need care, home care is both more humane and not as expensive as nursing home care.
Well, you know, I'm concerned as we are going through this, what I would call the crazy season, the presidential election, where people are offering alternatives which really don't recognize the contribution that senior citizens have provided to this country. You know, they always want to talk about the greatest generation, except when it comes to pay for it, you know. And I'm really kind of concerned that we're not really looking deep into not only our moral responsibility for those who have given this country so much, that we're trying to do it on the cheap. And I think that we need to begin to, in my own personal opinion, is begin to look at how do we provide the services in economic fashion to our senior citizens. Because there's always another way, a better way of doing it, to re-engineer something, what best practices are. But how do we get the doctors to do that, the hospitals? the insurance companies?
Well, it's a very tough nut to crack, you know. And just watched part of the debate for U.S. Senate from Connecticut earlier today, and one of the questioners was saying, you know, one third of the healthcare costs for many people occur in their last year of life. What do we do about it? Nobody really had a substantive answer to that question. I would say some tort reform would help bring the cost of medical care down, and more competition perhaps among Medicare vendors would probably help bring the cost down somewhat. You know, the Ryan plan, I'm sure, has some positive benefits to it. I'm not an expert on that, but it's certainly something we should be looking at and discussing, even if we don't go for the whole plan. It could get some efficiencies and even some improvements in care if certain seniors can go out into the private market with their Medicare dollars. But we'll see.
Well, you know, I began to think, and I was listening the other day to a radio show, and they were talking about in one of the European countries that they have a credit card that you use for your medical services. And so every time that you go to the doctors, it runs that the doctor slides that card through, and then the amount of that service, let's say it's $100, $200 for office visit, is sent in as a claim right then and there to the national health services that they use. And to me, I said, well, gee, that's an idea. Now here we are, the intellectual and invention geniuses of the world. Why aren't we doing that? You know, that would help cut down medical fraud because it would immediately show up in the down in the database that we could look at. We could begin to really get feedback to doctors. They wouldn't have to fill out all these forms all the time. You know, at least we ought to have one common form, you know, for medical services that everybody has to use. That would, you know, because I go into a doctor's office, you see all these folders lined up along the wall, you know, of files. Now, the thing that President Obama has pushed for electronic database will help some of that, but we need to be able to find ways to, you know, which I'm always shocked, really, that the politicians haven't looked at the vast majority of what's happening is in terms of the fraud that's going on, and I have to give President Obama credit for this, that he has been the most aggressive president in our history in attacking fraud in Medicare and Medicaid. But there's so much more that could be done on that, and we're talking billions, not millions, that could be saved by just putting more inspectors working on this whole area and more U.S. attorneys on this area, because the government, since it is the largest insurance company in America, why couldn't we really go at this aggressively and begin to bring that down? Is there some? Why isn't that occurring? I've been amazed because every IG and HHS have been talking about this that I can think of for 20 some years or more.
Yeah, it's a budget outlay, and the fact that it returns X dollars for every dollar you spend on an inspector that you bring in, an IG staff member that you bring in, you know, if they're not producing some multiple of their salary, something's wrong. I had a minor role and a minor assist on what was, and I think still may be, the biggest Medicaid fraud case in the country in South Brooklyn. That was over 10 years ago, so maybe just with inflation, some other crook has exceeded that case, but that was something in excess of $50 million in Medicaid fraud. So I know what you're talking about. You know, the credit card you mentioned in Europe sounds great. I think America, being as individualistic as we are and as privacy concerned as we are, I think there's still some resistance about electronic records. There's certainly a simplicity to it. It probably even would cut down on pharmaceutical problems where, you know, one doctor prescribes a drug and then another doctor prescribes a drug that doesn't interact well with that, but you've got to have a sharp pharmacist to catch that. Well, if you have this all worked up electronically, you might get a flashing red light before that second drug is even issued by the pharmacy through electronic records. But I think some people are concerned that if they have some sort of pre-existing condition, or they're going for a job or a promotion, that that could block them from it, because somehow they feel it's not secured. If you have electronic records in the system, some employer or someone else could get access to it. So if we can guarantee that it's going to be a really airtight system, that only people with a right to know, medical professionals, or obviously the Medicare and Medicaid systems themselves, and the patient would get access to it, I don't see any problem with it.
Well, we have the providers now get all of your information when you go in. No matter, without naming any insurance companies, they get all of your information. If you're on Medicare, Medicare has a third party who's verifying the expenses through and telling you what's been approved, and they'll send you a note once a month or so on about what's going on in Medicare. But what I'm really talking about is that we know we're large, from Florida, New York, Pennsylvania, and which states have large populations of seniors, which a few years ago when I was looking at, I think Pennsylvania, the Commonwealth of Pennsylvania was number 3 in the number of seniors.
Yeah, it's a surprisingly older state.
But people don't leave, or they come back to retire in Pennsylvania. And and having lived in Pennsylvania, it's a great community to live and work, But how do we get people to move from what I call sloganeering and begin to look hard at, one, bringing down the fraud? And that's why I give President Obama and them credit for that. I'm not one of these guys who don't acknowledge the things that the administration has done well. But there's a lot more that could be done, but they need more personnel in order to do that. And secondly, how do we incentivize our politicians to quit using us just for votes, just going out and scaring seniors, because we could save billions underneath fraud. They've already proved that in what President Obama's done to date. And if we intensify that effort, we could save billions more. And then if we would also, for example, an idea I've been thinking about is that when you're working for a company and they say they're going to, or a state government agency or federal government, and you're able to buy your insurance through them, that Medicare become a secondary insurance, not your primary insurance. I've never figured out why Medicare is your primary when you're getting insurance through your employer. So that, for example, let's use the federal government as an example, and I'd like to get your thoughts on this. When you're getting federal retiree insurance, you're paying the same amount you would if you were a full-time employee at the federal government. And the insurance company used to be responsible 100%, is now only responsible for 20%. So if you turned that around and said, if you're getting insurance through the federal government, state, or your company that you work for, or nonprofit organization that's giving you insurance for life or whatever it might be, then the Medicare would be only responsible for 20%. That's another billions of dollars that would be available in this pool. And the third idea is that we allow that we admit that sometimes we have to adapt things which come from elsewhere. For example, drug costs is cheap in Canada is 2 reasons, because most Americans here, we pay for the research here.
True.
And the second reason is that the Canadian government puts out for bid a lot of its pharmaceuticals. So in this country, the VA does that. And the VA has saved millions of dollars because they bid out their pharmaceutical requests. And so those 3 things I'm thinking of: one, the pharmaceutical companies, that we allow Medicare to bid for its pharmaceuticals. 2, that we, if you have your company who's in providing the insurance, even though you're a senior, you still have to join Medicare. but that Medicare would be only 20% responsible, and your insurance company would be responsible for 80%, which would be more billions of dollars. And three, that we increase the number of not only inspectors, auditors, and number four is the credit card idea that would that would go through. What's your thoughts on that?
I like almost everything that you've said. And then you first wondered, though, about how we get rid of sloganeering. I think as you get within a month of a presidential campaign, you can't get rid of sloganeering. But I do remember, or a number of politicians say, well, I would get to the deficit by doing X and Y and eliminating waste, fraud, and abuse. And then somebody responded saying, yeah, if we can ever find that line in the budget that says waste, fraud, and abuse, we can get rid of that. But of course, it's not listed in there that way. So your point about much more inspectors, I think, makes a lot of sense. It's, people throw the word investment around a lot, but I think that really would be an investment and would keep. And I think in particular with new immigrant groups coming on to areas like mine and certainly other areas in your state, if not where you live, there's, I think, more opportunity for fraud too, because folks who speak an arcane language, we need to get inspectors who speak those languages to do the people's business in rooting out fraud, because folks who come here with a new language can get away with more, even tricking their patients into more services or into signing stuff that they don't intend to sign. Some of your other issues, I think on the insurance companies, I just wonder if a deal was struck between those folks who provide insurance to federal employees saying, okay, we're going to charge this much as a premium to your federal employees, this much for the single rate, this much for the family rate. And then when Medicare kicks in, we drop back to being the secondary employer. So I don't know if that was a deal that was struck to keep premiums at a certain level, so that if all of a sudden they become the primary provider for people 65 and older, and then the whole deal goes out the window, and then they have to charge more premiums both to workers and to retirees. I don't know. I think it's something that would just strike me as not implausible, as something that happened, to get you the premium that you have.
Well, but is in the federal government, what happens a lot of times is that during your early years, people take the least expensive program. And as they get older, they start taking the program that offers them more care, because so what I'm talking about is like OPM really looking at this in a such with Congress to look at this in such a way. It's just to see if it's a doable alternative, because right now they get a tremendous savings when as a federal employee, you're paying the same amount you would if you were there. And OPM, as you know, and when people start talking about providing the same health care for themselves, congressmen talk about, well, you ought to have the same health care and the same. Well, the OPM offers you a large variety, like a smorgasbord of various different insurance programs that you can select. And that's not a bad idea in terms of opening that up across the board. The bad idea is that when you're only going to be given underneath Medicare, that 80% is going to be covered at any one time. No matter what it costs, there's 80% going in. And so I'm looking at what I'm trying to look at is ways that begins to relieve the federal budget of that cost. Because of the savings that you get from going after waste fraud, and the secondly by initiating the credit card, and third by outsourcing the pharmaceuticals, that all those savings go to keep the costs of Medicare down, because you have a large part of people now on Medicaid too who are some of them are disabled. They're also seniors whose incomes are so low.
The biggest chunk of Medicaid spending in New York City is seniors who are too poor to afford the home care or the nursing home care, or they've exhausted all their private savings, and so they're on Medicaid.
Yeah, I don't. This is not this is one of the questions because, we have John Waters who's coming on, who was one of the drug czars for this country. And John is, he's going to be on the show. And he is really, he's at the Hudson Institute now, a think tank. And I'm really interested in hearing from John what kinds of policy outlook options are they developing in Hudson Institute that, because, I think we need a Manhattan Project. I keep talking about that, to look at ways to reduce our costs so that the government and its people get more for its bang on the bucks, and so that because I think anyone who's talking about the potential of seniors having to come out with $6,400 additional a year out of their pocket, or even $2,400 out of their pocket, it doesn't matter what that number is. When they know that Social Security goes up very little each year, if any, and for a significant number of seniors, Social Security is their only income.
Yeah, my parents were in that situation. Yeah.
Yeah. So what do we do about that? That's what I'm saying. Have real discussion on these things, and without the demagoguery, and really talk about how we're going to keep Medicare solid, and how we're going to provide those services, and really go at waste, fraud, and abuse. And I'd like to see them, do a report card, have to do a report card every year to the American people, how they've attacked these issues, and then and give them a grade, A, B, C, D, E, or F. And so we'd be able to look over and say, the guy doing healthcare administration, your evaluation shows you're not doing very well on waste, fraud, and abuse. You're out of here.
Yeah.
I mean, is that too much to ask that people do their job?
No, I think that's great. And of course, you and I are both proponents of using the evaluation process. Too many people just put that off forever. But that's actually a way, I know in federal service, and especially New York City service, we got rid of some bad apples by using the performance appraisal process. And by the way, most other employees in each department, whether it's federal or city, appreciated that, because they recognized that if somebody else sitting next to them is dead wood, they probably have to carry a heavier workload.
Mm-hmm. Well, it's not just when we talk about Medicare, we ought to be talking about also the health services that are given to our veterans, which really have a long way to go to become first class. And the process that it takes for a veteran who's coming back, who's served this country, to be served by the VA, in order to get treatment, and the forms and everything else that they're going through. And I was with a doctor working for the VA the other night, and he's talking about all the paper. And I'm just wondering at some point that the VAs, I like to see a president or a presidential candidate announce that they're going to make the VA a model health services in the country, in the world, and that our veterans who serve us, who come back injured, both physically and mentally, from the various wars that we've chose to fight as a country, are going to get first-class medical treatment, and that we're going to get it in a timely fashion, and I'm one of these guys who say, no matter what it costs, I want my veterans who are protecting my life, and my kids' life and my grandkids' life, to have the top-rate medical service in the world. And so we need to look at how we can improve the medical care for our veterans, and we can learn from the VA, because they're outsourcing their pharmaceutical companies and saving millions of dollars. But we could also provide best practices to the VA.
Yeah, I'm sure they could take certain VA centers and make them best practices pilot projects, and any decent administrator running one of those places would want to be that pilot right away.
Yeah, I don't have, I look at health services. Those are the major ones in the country, and we're, by the way, when we're talking about politics, we have Dr. Watson, who's going to be coming on the show, who's a presidential scholar. And then we have the president of the Young Americans Foundation, who's going to be coming on the show, whose ideas of keeping Reagan alive, and you know him very well.
Yeah, I've known him since I was a teenager.
Hold on. I think he's younger than that.
He is 8 months younger than I am, but
well, Ron and them are having their convention down in Orlando, Florida, on I think it's the 12th and 13th of this month.
Okay.
But Ron's going to be on the show, and so what we're really trying to do is to get a discussion going, Herb, on all these issues out there. You know, they have the Reagan Ranch, the Young Americans for Freedom. They've kept people alive, and I think really keeping the Reagan philosophy in line. And I hear all these people talking about Ronald Reagan, but if you want to be Ronald Reagan, then be like Ronald Reagan. Just don't quote him when you're trying to win votes. Really begin to work for the betterment of this country like Ronald Reagan did.
Yeah, well, now, you know, even Democrats are quoting Reagan just the way they quote Lincoln. So, and of course, Republicans do quote some of their favorite Democrats too. So, you know, that's a good thing that you know, folks who've served the country well get treated later on, and you know, years after they're gone, by both parties with affection.
I've always been told that, you know, Ted Kennedy, when one of his regrets was that he didn't take Nixon's agreement in terms of the health care. Remember when Nixon was talking about universal health care, and that was one of his regrets. And again, that's because he was thinking party rather than country at that moment. And so that Nixon had made a proposal for universal medical care. Herb, I really appreciate you taking the time to talk with me today, and I've always appreciate your counsel and your service to this country. And I know that as your work at Baruch College, you are providing to those graduate students knowledge that they can only get one other place, and that's through you.
All right, Lawrence. Well, as you know, your viewers don't know this. You were a guest speaker who was very popular with a different set of my students a year ago. So I appreciate that, and I appreciate your support and friendship over the years too. So you've been a great addition to our country, whether you've turned around a nonprofit or serving the U.S. Congress, serving President Reagan. And how many other presidents? You started with what, Johnson?
Well, I like to say that I started with Richard Nixon.
Okay.
And I was chairman of the Vocational Advisory Council underneath Nixon, and then vice chairman of the Equality of Education. And Reagan, though, was the greatest president that I've ever worked with in my life because of the visionary that he had. And he understood that personnel was policy.
That's right. That's right.
And most people don't understand that today. They make deals to appoint somebody to this position, that position, not understanding that they're giving away their policy. And because you got to have people who believe.
Absolutely.
In the Reagan Revolution.
Absolutely.
That's why Reagan is still quoted so much these days, because he picked the people, and they put the team together with Ed Meese and Mike Deaver and Jim Baker, all of them from a different point of view that led to, and I'm looking forward to talking about that with Dr. Watson next week. Herb, thanks again, buddy. It's always a pleasure.
Thanks so much. Have a good evening.
Same to you.
Bye now. Bye now.